all of our afflictions, whether it's addiction, chronic physical illness, what we call mental illness, dysfunctions, they all have a template of childhood wounding, and they're not separate biological events happening in discrete individuals, but they are representative of a process inside each of us that manifests a relationship to our environment. Most importantly, our early rearing environment, but also the culture that we live in. So that, to give you one example, it's an obvious example. If you look at the number of kids diagnosed with, say, ADHD, the numbers are going up all the time. That can't be an individual thing. That has to say something about the culture, the context. Or if you look at the rising incidence of autoimmune disease, the rising incidence of addictions, of mental health conditions. If you look at the fact that, say, Black American women, the more experience of racism they have to endure, the greater the risk for asthma. It just tells us that it's not just about individual biology, it's about life in a culture. We're meant to raise children by evolution. So we destroyed that for them. And now we wonder, why do they have more alcoholism? Why do they have more addiction? Why do they have more illness? Why do they have more violence? It's because we've robbed them of their nature. So when I talk about a toxic society, I'm talking about a society in which what is normal is completely unnatural and unhealthy.
Yeah. But this, of course, is rampant across all sectors of the developed world. So nobody's immune from this.
No, it's
something is terribly awry. Like, we are completely out of balance.
We're out of balance. Here's the thing. We're out of balance. Now, that imbalance affects some people more than others, but it does affect everybody. There's no stratum of society that escapes the stresses. And where we're out of balance is that we have certain needs as human beings. See, children have 4 basic needs. They have a need to be strongly attached to adults who take care of them, who are with them all the time, by the way, because as we evolved as human beings over millions of years, and for most of our species existence as Homo sapiens, we lived in small communities where the parents were always around the kids, so secure attachments.
And extended family.
Well, community,
right?
And then children have a need not to have to work to make their relationship with the parents work. They have to be able to rest in the security that there's nothing they can do to destroy the relationship, and there's nothing they need to do to make it work. Now, in our society, we make our kids work to be accepted. You have to be good, you have to be smart, you have to be good looking, or you have to behave acceptably. Otherwise, you're going to get a timeout, and we're going to say to you, no, you can't be with us. We're going to deprive you of contact for a little while. Jordan Peterson, Canadian psychologist, says that an angry child should be made to sit by themselves until they come back to normal. In other words, it's not normal for a kid to be angry. Well, let me tell you, it's very normal for a 2-year-old to be angry because they get frustrated. Now, if we give the message to a 2-year-old, you're not acceptable to me when you're angry, basically you're saying to them, don't be yourself, suppress who you are in order to be accepted.
Love is conditional.
Love is conditional. That's the message you're giving.
Yeah.
A lot of kids in this society are getting the message that love is conditional. We tell parents not to pick up their crying babies. Now you tell them
they need to learn how to be okay being without that nurturing that's so crucial in that.
No, you tell a mother gorilla not to pick up their baby when it's crying. Or tell a mother cat to ignore the little kittens meowing, but so that children have the need to be able to experience all their emotions fully and that be accepted by the parents. Well, we tell parents, no, your children's anger is not acceptable. So children get the message that they're not acceptable. You have to work to be acceptable. You have to suppress yourself to be acceptable. And children need free play out there in nature. Free play, not with gadgets, not with cell phones, not with games on the internet, but free play in nature. These are essential needs of human beings.
Mm-hmm. That goes into the four that are really six, this like 6 A's that you talk about in the book, right?
Well,
And
the
agency would be like the ability to like roam and be outdoors, and attachment being important as well.
Well, attachment is, well,
authenticity, agency, acceptance,
autonomy. These are the healing pathways. What I'm saying is, for people to heal, they have to find their own agency. They have to, whatever happens to them, they need to participate in the decisions that affect their lives, particularly the health decisions. So for that, and so it's very interesting. There's a couple of people that I know who have looked at what's called spontaneous remission. Spontaneous remission is supposedly when somebody spontaneously gets better after having been given a terminal diagnosis. And there's a psychiatrist at Harvard, Dr. Jeff Rediger, who, by the way, you might want to talk to sometime.
Mm-hmm.
He's written a book called Cured, the science of spontaneous healing. He studied people, just as I have, who got better despite giving terminal diagnosis after the failure of medical treatment, or even if they refused medical treatment. Dr. Kelly Turner, is an oncological psychologist who worked with cancer patients. And she also did a study of people who got spontaneously better. Spontaneously. But when I talk to these people, or when Kelly Turner or Jeff Rediger talks to these people, there's nothing spontaneous about their healing. They all did something. And the biggest thing they did is they developed a different relationship to themselves. They became authentically themselves. They stopped pleasing people. They actually consulted what they needed and wanted within themselves. Now, I'm not saying that this is a magic cure-all, but I'm saying that the people that do get better on their own, with or without medical treatment, in the face of terminal diagnosis, they're the ones who took agency over their lives.
Mm-hmm.
And in our medical system, people are made to be very passive recipients. You're the experts. Do to me what you need to do. So agency is very, very important. Healthy anger is very important. Healthy anger is, I begin chapter 2, I think, with the case of a woman who's given a diagnosis of 2 years to live with metastatic breast cancer. And the doctor's telling her that the statistics means that she's got 2 years to live. Now, she's got 2 young kids.
Mm-hmm.
And she says to the doctor, "Fuck your statistics." She says, "That was very rude." I said, "What do you mean rude?" She says, "I said to him, 'Fuck your statistics.'" I said to her, "Thanks, that's great. That probably helped you survive." She lived another 20 years. Partly because she stopped being a people pleaser and she got in touch with her healthy anger. She did die of her cancer, but only after she raised her kids to be young, successful young men.
Yeah, she said, like, I need to raise these boys. Like, I can't die yet. I have work to do.
Exactly.
And one of them ended, and she did. She 20 years, and one goes on to Princeton or something like that. So she fulfilled that.
And in the book, I give examples, and never mind terminal illness. People with multiple sclerosis who've been told they have to be on medication for the rest of their lives, they're okay without medication now, and they have no symptoms. People with rheumatoid arthritis, the same thing. Why? Because they got in touch with their real selves. They stopped suppressing themselves. They stopped trying to please everybody else. They said, "Who am I? What do I need? What are my interests?
Mm-hmm.
What do I need to say no to? What do I need to say yes to?" And I'm telling you, a lot of these conditions, which are considered to be chronic and incurable, they're not necessarily, And there's a case I give in the book of a woman with scleroderma. Scleroderma is autoimmune disease. Sclerosis means hardening. Derm means skin. Scleroderma means hardened skin. In scleroderma, the connective tissues of your body get stiff. And this woman, age 29, she said, "I was being mummified alive." She became like a rigid mummy. She could barely move. She could not get out of bed by herself. The medications failed. They didn't work for her. All she wanted to do was die. Now, she's walking around, hiking, writing her autobiography, winning poetry contests, because she turned her relationship, and because she dealt with her childhood trauma, which none of the doctors asked her about, of course. And she became authentically herself. And these are not fairy tales. I talked to her physician who verified the story.
Me Oak.
This is Me Oak.
Yeah, Me
and
Oak.
She happened to do it through, her healing happened through an experience with a psychedelic, which allowed her to recognize her true self, and a lot of other work besides. But what's the message here? The message here is that illness is a manifestation of a person's trauma and a person's life. And if you turn that life around, you can very often have a positive impact on the illness as well.
Right.
I'm wondering, could you say a little bit about the compassionate inquiry process that you often suggest or work with people? Can you say a little bit about what that entails?
Yeah, so I was in family practice before I went to work in the downtown east side with addictions. I was in family practice, and for 7 years I was also the medical coordinator of the palliative care unit at Vancouver Hospital, looking after terminally ill people. And as a family physician, I have an advantage over the specialist colleagues. I knew people before they got sick. By the time I send you to a neurologist with your numbness or your blindness, temporary blindness, or a gastroenterologist with your abdominal pain and your diarrhea, or a rheumatologist with your inflamed joint, we already know where the disease is. The rheumatologist only sees you if somebody who's already ill. But I knew people before they got sick. And I knew them in the context of their multi-generational families of origin. And I got a clear sense of who got sick and who didn't, and it wasn't accidental. And I distinguished 4 personality traits, and we talk about this in the Myth of Normal, of the disease-prone personality, and you already mentioned one of them. The first one is an automatic and compulsive concern for the emotional needs of others while ignoring your own. Number 1. Number 2, a rigid identification with duty, role, and responsibility rather than the needs of the self. The third one is this pathological niceness, where people are always so nice and so kind and so friendly to everybody. Why? Because they repress their healthy anger, which is essential for survival. Healthy anger, we have a circuit for it in our brain. It's important for survival. And the fourth one are 2 beliefs. One is that you're responsible for other people feel, and second, that you must never disappoint anybody. Now, these traits, I kept noticing them in people who got sick with rheumatoid arthritis, multiple sclerosis, malignancy, colitis, Crohn's disease, chronic eczema, psoriasis, any chronic autoimmune disease, and very often malignancies. And the essence of it is emotional disconnection from yourself. Now, at first I just thought I was seeing things. Well, I was, but they were true things. What I didn't know, that there's a vast body of literature, research, showing the relationship of these traits to chronic illness of all kinds, autoimmune disease, malignancy, and so on. So once I realized that, and not to mention, once I began to see the connection between childhood trauma and every mental health disorder you can possibly diagnose, from addiction to ADHD to everything else, I thought, well, it's not enough. It's fine. I need to give people or make people, avail people of the essential physiological medical treatments, but it's not enough. You got to talk to people.
Yeah.
But who's going to talk to them? My patients couldn't afford private psychologists, and psychiatrists don't understand any of this stuff. It's just not. It's not their fault. It's not part of their training. The average medical student, I want you to hear this and get it. The average medical student does not hear a single lecture on trauma. Not one. In 4 years of undergraduate training, not one. Most psychiatrists have a very shallow understanding of trauma based on their training. So, where am I going to send these people? I have to start. But they say, yeah, you can teach it. And finally, they talked me into giving a weekend workshop in Toronto for psychotherapists on this method, so-called. And I was really hoping, honest to God, I was fervently praying that nobody would sign up because I was desperate not to expose my utter incompetence in front of, sure enough, 300 people signed up and we did it and it was successful. So then this course, but it's really based on the essential idea. Well, have you had H. Almas here? And Almas says, only when compassion is present will people allow themselves to see the truth.
Wow.
So that's the compassion part. And that with the right questions in a compassionate setting, people will come to the truth of themselves.
Mm-hmm.
So that's what this whole idea is based on.
Yeah. And how much of it is around identity do you work? That somebody sees them, how much of it is around identity?
Yeah.
So if somebody sees themselves, I'm strong, I'm successful, I'm powerful, I'm this particular identity, and I have to be that identity in the world. And the body does not want to go with that because it means you have to suppress another part in order to be the one part. Is that something that you see playing out? And how do you work with that?
Yeah, well, identity or identification comes from the Latin idem, the same, and facere, to make. So when you identify with something, you make yourself the same as.
Okay.
So if I identify as a doctor, then my status in the world, my self-respect, my value, how I want to be seen, is dependent on that particular role. But who am I really underneath all that? So identification is always, it contains an element of falsehood in it. Even if you identify with something true in yourself, if you make yourself the same as that one particular thing, you're diminishing yourself.
Right.
You're diminishing yourself. And that identification is how we develop the personality. Mm-hmm. So that the personality is an amalgam really of some genuine traits, but also with certain dynamics that we identify with because we're afraid not to be them.
Right.
So somebody who's very strong will never have the courage, or somebody who identifies with being strong will never have the courage to say help. Mm-hmm. Right. Because to say help would be to undermine the self-image. I can handle everything. And believe me, it's hard for me even to fathom this anymore, but in my 40s, I consciously believed that everybody else could be stressed personality or limiting us.
Right, right.
Take a deep breath. What you've heard so far is about finding yourself again, but healing doesn't end there. In the next part, Dr. Gabor Maté reminds us that our pain is not only personal, it's shared. He shows how society itself shapes our wounds, and how true empowerment begins when we start to heal together.
First of all, I'd like to rephrase the last question, not female empowerment, but human empowerment. Yeah. Because in this culture, both men and women lack genuine power. Because they're so driven by unconscious forces. They lack power. That's the and when you're driven by the unconscious, you're like a puppet on a string, being pulled by these traumatic imprints. Yeah. So it's human empowerment that we're talking about. Okay. So that's the first point. The second point is, particularly in the United States, the shocking fact is that 25% of women have to go back to work within 2 weeks of giving birth. Yeah. You know what that amounts? No, you know what that amounts to? It amounts to a massive abandonment of infants. Yeah. Because the infant needs that mother for a long time. So basically, this is a brutal culture that abandons right off the bat, 25% of the infants. That's the first point. The second point is that the influences on brain development of the human being, according to multiple studies, already the mother's emotional states while she's carrying the baby has an impact on the child's brain development and future mental health. So mothers who are stressed or depressed pregnancy, their infants are more likely to have ADHD, for example, later on. Now, does any woman choose to get depressed or stressed? No. Why should we blame her as an individual? But what we could do is we could train physicians that when a pregnant woman comes to them for prenatal care, we don't just do ultrasounds and blood tests and blood pressure and weight measurements. We also say, how are you doing? How are you feeling?
Yeah.
How's your relationship? Are you getting the support? You could listen to women. And if the doctor doesn't have the time, let's find other people. Let's find a nurse. Let's find somebody else. We'll spend the time and listen to the woman. Or just being listened to empathetically immediately changes the emotionality of your body. You know? So that's just a very simple little thing that we could do. Secondly, we could look at how we give birth. We completely medicalized birth.
Yes.
Birth is meant to be not just an exercise in pushing the baby out of the womb, but in creating a bond between mother and infant. How does birth do that? Natural birth do that? By releasing hormones in both the mother and infant that promote bonding. Oxytocin and endorphins and vasopressin and so on. That's what's called a love cocktail. Now, modern medicine is absolutely essential, to save lives. And modern obstetrics has saved the lives of many men and many women, and many infants. Absolutely essential. But we've overdone it. So that there's a cesarean section rate in many areas of North America that's over 40%. Cesarean sections, when they're necessary or life-saving, but that's in about 10 or 15% of cases. The rest of the time, we've over-medicalized it. We're interfering with the bonding. We could demedicalize childbirth. We could actually put childbirth into the hands of midwives again, or physicians who are trained like midwives. And statistically, the outcomes are a whole lot better. Thirdly, we could actually save a whole lot of money in the legal system, in the educational system, if we provided decent support for young families at risk. We could introduce human developmental education into the education of teachers, so that teachers would understand that the human child develops, first of all, emotionally, and that the circuits in the brain that promote learning have to have emotional safety for their healthy development. So we wouldn't be stressing kids with standardized exams and rules and so on. We'd be promoting their play. Play is essential. We have a circuit in our brain for play. We share that with other animals. The reason I put my little cat outside the door, which is a kitten, and we'd be jumping on this table, playing all the time, that would interfere with our conversation. But that play circuit in our brain, we share that with other mammals. It's essential for healthy brain development. Our schools would be situations of emotional support, emotional understanding, and lots of play, creative play. Then our kids would easily learn all the facts and all the data that we want them to learn, because they have healthy brains. This would save us a whole lot of money. What if teachers and parents understood that the child is acting out? The behavior is only a symptom of emotional distress. And if we address the emotional need, which is close connection with nurturing adults, that child will stop acting out because they don't have to anymore. But instead, what do? Rules. We punish them. We intimidate them physically. We intimidate them emotionally. We threaten them with loss of contact.